When Gabby started shedding a lot, I figured we'd be seeing a lot more of her archenemy, the vacuum. But then my vet said,
shedding can be a sign of poor nutrition.
Who knew shedding could be so serious?
For the health of your cat, I recommend Hill's Science Diet Adult. It has a precise balance of 50 nutrients, including powerful antioxidants for a stronger immune system, and a healthy difference you can see.
Gabby has never looked better.
Hill's Science Diet, vet's #1 choice for their own pets.
When it comes to our health, many of us feel left behind. It's time to join the revolution. Stand up, my feline brothers and sisters. Demand year-round protection. March your owner into your veterinarian today and demand revolution. Revolution is the medicine that will keep us healthy. Long live the revolution!
See your veterinarian or visit us at catsoftherevolution.com.
Hello, I'm Dr. Morgan Dawkins, Medical Director and one of the owners here at Windcrest Animal Hospital. Windcrest was established in 1954 by Dr. William Gallery in a 4-room home converted into a veterinary hospital. In 1983, it was purchased by Dr. Bruce Damey, and in 1997, we moved into our new state-of-the-art facility. For over 23 years, Windcrest Animal Hospital's mission has been to provide the finest quality pet care available. We are committed to the human-animal bond and treat all pets as if they were our own. Over the next half hour, you'll get to meet our veterinarians and staff, whose passion in life's work is caring for animals, and learn more about the services we can provide.
It's 1 a.m. and your pet is sick or injured. Quick, where do you go for help? Pet emergencies are stressful situations for both animals and their owners. Just like the golden hour in human medicine, seeking appropriate veterinary care within the first hour of injury can greatly improve your pet's chances for making a full recovery. Mid-Atlantic Critical Care and Emergency Veterinary Center, located at Windcrest Animal Hospital, provides care 24 hours a day, 7 days a week. A dedicated staff of doctors and technicians is always available to provide care for the sickest of the sick. Spot, a 7-year-old mixed-breed dog, was playing in the yard at his home when he ran out into the street where he was then hit by a car. Spot was immediately brought to Mid-Atlantic Critical Care and Emergency Center at Windcrest Animal Hospital by his owner. Our team of skilled emergency technicians meets Spot's owner at the emergency entrance and proceeds to her vehicle where they assess Spot's condition and prepare to transport him via the pet stretcher. Spot is carefully moved onto the stretcher and once secured in place is carefully carried to the triage and treatment room located inside the hospital. Upon initial examination by the critical care veterinarian, Spot appears to have symptoms of shock, decreased level of alertness, low blood pressure, slow heart rate, and respirations. He also appears to have sustained an injury to his rear left leg. The veterinary technicians quickly place an intravenous catheter into a vein in Spot's front leg to allow administration of life-saving fluids and medications. After checking the patency of the catheter, the technician secures it in place with tape. Spot is now transferred to our radiology room to have radiographs performed to assess the severity of his injuries. Our technicians remove Spot from the pet stretcher and carefully place him onto the X-ray table to shoot the films. Various film views will be taken to give the veterinarian a comprehensive view of the injury. Unfortunately for Spot, the radiographs show a fracture of the femur, the bone between Spot's hip and knee. In the examination room, the veterinarian explains Spot's injuries to his owner. Spot will need surgery to repair the fractured bone. Just like in human medicine, there will be a lot of preparation both before and after Spot's surgery procedure. The technicians have drawn Spot's preoperative blood work and the results are normal. After determining that Spot's medical status is stable, he is taken to surgery. After receiving pre-medications for sedation and pain management, Spot is given an intravenous medication to anesthetize him. Spot also has an endotracheal tube placed down his trachea to maintain an open airway, administer oxygen and gas anesthesia, and prevent fluid from going into his lungs. The most critical time during Spot's surgical procedure is during the induction of anesthesia. While anesthetized, parameters such as heart rate, blood pressure, temperature, carbon dioxide levels, and oxygen saturation are constantly monitored by our technicians to assure a safe anesthetic procedure. The hair at the operative site is shaved, Spot's leg is suspended, and the skin aseptically scrubbed to allow for a sterile surgical procedure and prevention of infection. Dr. Morgan Dawkins prepares for surgery by performing a surgical scrub. Wearing cap, mask, and sterile surgical gown and gloves, he enters the operating suite. Spot is carefully and completely draped with sterile towels by Dr. Dawkins in preparation for the procedure, and the sterile instrument pack is open. Because it is difficult to fully clean the foot, it is covered with sterile material to protect the surgical field. A carbon dioxide laser is used for cutting during the procedure to reduce bleeding and post-operative swelling and pain. After surgery and post-operative radiographs have been taken, Spot is moved to the recovery area for constant monitoring by one of our veterinary technicians as he awakens and is extubated. Spot will stay in recovery with a technician until he has recovered enough to return to the intensive care unit. The sterile plate and sterile screws, which were used to align and stabilize Spot's fracture to allow it to heal, can be seen on the radiograph.
This is Spot 2 weeks after his surgery. While in the hospital, he received inpatient rehabilitation. His sutures are now out and Spot is ready to begin outpatient rehab. On the first day of his rehab, Spot will be evaluated by our therapist, Kate. She would take baseline measurements just as range of motion and muscle mass. Spot will also begin simple exercises like the TheraBall for strengthening. Most of Spot's therapy is in the water, where he can get great resistance without putting a lot of weight on his legs. Watch Spot in our underwater treadmill. The treadmill has helped him walk more efficiently while gaining strength and endurance at the same time. The underwater treadmill can be filled with water at various heights for the purposes of buoyancy and resistance. Spot is not ready to climb the stairs yet, so we're using the hydrolift to help him into our endless pool. Spot loves to swim. He could do this all day long. It has been 8 weeks since Spot's surgery and his recovery is remarkable. Kate is quite pleased with the results. Spot is now on his last day of therapy doing advanced exercises, which he started a few weeks ago. Now he is fully healed and has achieved all of his rehab goals. He has normal motion, he has gained his muscle mass back, and he is playing with his family again. His owner can't tell he ever had surgery. We're all happy Spot's done so great.
When it got easy to tell from his shedding where Spot's favorite spots were, I didn't think it was a big deal, but my vet said,
Shedding can be a sign of poor nutrition.
who knew shedding could be so serious?
For the health of your dog, I recommend Hill's Science Diet Adult. It has a precise balance of 50 nutrients, including powerful antioxidants for a stronger immune system, and a healthy difference you can see.
Spot has never looked better, and neither have his favorite spots.
Hill's Science Diet, vet's #1 choice for their own pets.
When it comes to our health, many of us feel left behind. It's time to join the revolution. Stand up, my feline brothers and sisters. Demand year-round protection. March your owner into your veterinarian today and demand revolution. Revolution is the medicine that will keep us healthy. Long live the revolution!
See your veterinarian or visit us at catsoftherevolution.com.
Imagine what would happen if you didn't take care of your teeth regularly. The same basics of dental care also apply to your pet's teeth. Periodontal disease is the most common disease in dogs and cats. By the age of 3, about 85% of dogs and cats has some form of periodontal disease. The infection associated with this disease can be responsible for your pet's bad breath. So what's a good pet owner to do? Regular brushing at home, regular evaluations by your veterinarian, and wellness dental cleaning procedures each year will help keep your pet's mouth healthy. Today, Nola, a 6-year-old Rottweiler mix, is having her wellness dental procedure. As you'll see, the dental cleaning is actually a surgical procedure. Just like you and I go to the hospital for surgery, there will be a lot of preparation, both before and follow-up after this procedure. Anytime an animal or human is anesthetized, it's a serious procedure. Dr. Sherry Wood performs a complete physical examination prior to putting Nola under anesthesia. Heart and lungs are checked. Range of joint motion is evaluated. Blood work is also done prior to the procedure to ensure no medical issues are present. Nola also receives pre-surgical pain management via an intramuscular injection to decrease her stress during this procedure. Our trained veterinary technicians are with Nola throughout the entire procedure. An intravenous line has already been inserted to administer anesthesia as well as fluids throughout the surgery. Nola is then moved by our technicians to the dental table for the cleaning procedure. She's placed on a water-heated pad to maintain her body temperature during her dental cleaning. The type of anesthesia used is a state-of-the-art medication, which will allow Nola to get to sleep quicker, which will reduce her stress. Nola also has an endotracheal tube placed down her trachea to maintain an open airway, administer gas anesthesia, and prevent fluid from going into her lungs. Our anesthesia has the least amount of medical complications or side effects. The most critical time during Nola's dental procedure is during the induction of anesthesia. Just like in human hospitals, Nola is connected to an ECG machine to constantly monitor her heart rate and rhythm, and pulse oximeter to monitor the oxygen level in her blood during the procedure. During dental cleaning, Casey, our veterinary technician, uses a hand scaler to remove tartar from Nola's teeth. Nola's dental disease is considered to be stage 2, with mild to moderate gingivitis and mild to moderate plaque and calculus, which have accumulated on her teeth. Home dental brushing done on a regular basis can help to decrease the amount of calculus and plaque buildup on the teeth. Dental chews, as well as oral rinses and gels, can also help your dog or cat fight plaque-forming bacteria, which can be harmful to their health. Following the hand scaler, Casey uses an ultrasonic scaler to remove the remaining plaque and calculus. Each tooth is then carefully polished by the veterinary technician with dental paste. It's important that all sides of each tooth are carefully and completely polished. The polishing is followed by an antiseptic rinse, and a 5-minute fluoride rinse completes the dental cleaning portion of the procedure. Dr. Wood has requested a digital dental x-ray be taken of Nola's teeth. This x-ray, similar to the one found in dentist offices, does not use x-ray film and is safer for Nola because there is less x-ray exposure. Nola's x-ray, which is immediately available to the veterinarian on the computer, shows healthy teeth with strong periodontal ligament, good attachment to bone, and no bony loss. Nola is then moved to the recovery area, where Christy, one of our veterinary technicians, continuously monitors her, shown snuggling under our Gamar air warming blanket during her recovery period. The endotracheal tube is removed, and Nola continues to wake up from the anesthetic while being carefully monitored. Once completely awake, Nola is taken back to the hospital run for the afternoon and will be discharged to her owner later today. With proper home dental care, Nola will be able to maintain her healthy white smile and good dental health.
Windcrest has continued to grow and now provides referral services for avian and exotic care, reproduction and pediatrics, canine rehabilitation, cardiology, behavior consultation. In 1998, Windcrest Animal Hospital started to provide focused care for avian and exotic pets. We've grown from one doctor seeing a few patients to now having 3 doctors with a special interest in providing the highest quality care for unusual pets. Windcrest Animal Hospital began to provide focused exotic animal care in 1998 when I joined the practice. Since that time, the service has grown significantly. In 2005, I was joined by Drs. Delatorre and Montgomery, who have the same strong interest in providing high-quality care for unusual pets. We are excited to announce that in 2005, this service evolved into Mid-Atlantic Avian and Exotics Veterinary Center at Windcrest. Windcrest Animal Hospital can provide the state-of-the-art care for exotic species, including in-house blood work, radiology, endoscopy, and ultrasound. Our emergency service is also prepared to handle emergencies 24 hours a day. One of the most important services provided is wellness care, including nutrition, environmental, and behavior counseling. Windcrest also provides exotic animal boarding services.
Hi, my name is Dr. Cullen, and my job at Windcrest is to provide reproductive services, and part of that reproductive services is taking care of baby puppies. These 3 puppies, Dawn, Amber, and Yankee, named for being born on the 4th of July, actually came here before they were born. Their mother, Tammy, came in for a prenatal checkup where we did an ultrasound and were able to see the 3 baby puppies growing inside of her. That allowed us just to kind of ensure her general health and plan ahead for her delivery. These babies came in 2 days after birth where we did, neonatal exams to ensure that they were healthy, had no birth defects or any problems that we would need to treat medically. And fortunately, they were all extremely healthy. They're 3 weeks old now and they're back for a recheck just to ensure that they're gaining weight, have normal hearts, and that everything is going well with them. It's important to weigh puppies frequently just to make sure that they're eating enough, that they're not becoming dehydrated, along with just general good practices such as deworming, such as most puppies have worms at some point in their life, and that can stunt their growth or cause constipation. So that's important to make sure that they're taken care of. They're too young for their puppy shots right now, but when they're 8 weeks old, they can come back, start getting on a regular vaccination schedule, and hopefully this will lead to the perfectly healthy, happy puppies that most people want to buy. On the other end, as far as reproductive services, we actually offer semen collection and shipping so that if the father lived across the country, we could actually perform an artificial insemination and have parents on different sides of the country to ensure that you're getting the best possible genetics and bloodlines possible without being restricted by airline shipping or having to drive a long distance to use a particular stud dog. Reproductive services are available at Windcrest by appointment. Please call our front desk and we can work with you to schedule the best time for your pet's needs to ensure that puppies are as happy and healthy as possible.
This is Windcrest Ultrasound, and this is the room where we come in and do ultrasound on our animals when we need to do further diagnostics. And we can do soft tissue ultrasound, primarily abdominal ultrasound, looking at organs within the belly basically. And we also do cardiology in here, cardiac ultrasound. I will be looking at our cats and dogs if doctors feel they may have a tumor in their abdomen or abnormal kidneys. I look for bladder stones, bladder infection, all sorts of things. And to do the procedure, we generally clip a spot on the belly. Most of the time the animals are not sedated. They come in, we just restrain them gently and go ahead and perform the ultrasound. The other service that's done in here is cardiology service. We have Dr. Lorraine Diager, whose practice is limited to cardiology, and she will come in and do a complete cardiac ultrasound. Toby's going to cooperate and let us do a little of that so that you can see what might happen. This is cardiac table. Sweetie. And the animals for cardiology have to be laid on their sides. If we're looking at their belly, they're laid on their back. Cardiology, we have a cardiology table with a cutout, and we just bring our probe, which uses sound waves to bounce off the internal organs. We clip a spot or just wet it thoroughly with alcohol. Sometimes that'll be good enough and more. And then we'll actually be able to see on our ultrasound machine the beating heart. And we'll actually be able to take measurements of the chamber sizes, wall thicknesses, look for anything that might be causing a murmur, abnormalities, that kind of thing. Dr. Diager will include with her workup an EKG, blood pressure, chest radiographs, so that she can look all inclusive at the heart and see if there's any problems. Roll him on his back just so you get a little bit of an idea what we do with an abdominal ultrasound. And again, the belly would probably be clipped for this. So we always warn our clients that the animals can come a little bit low. And there we can see he has a bladder that's flat image on their second bladder, which is looking very normal. Generally, we'll borrow your animal for about an hour of time to do any of these procedures and then return them to you and go over our findings.
In 1999, Windcrest Animal Hospital opened Wilmington's first 24-hour-a-day, 7-day-a-week emergency and critical care service. In 2005, this service became Mid-Atlantic Critical Care and Emergency Veterinary Center, with a staff dedicated to providing care for the sickest of the sick, for our clients and clients of our referring hospitals. We value the relationship with our referring hospitals and work closely to maintain a partnership that benefits the pet, client, and referring doctor. In 2004, Windcrest Animal Hospital opened Delaware's first aquatic rehabilitation services. Our center provides an underwater treadmill, endless pool, and other therapeutic modalities. The service is run by Kate Christian, who holds a Doctor of Physical Therapy degree from the University of Delaware and is in the process of being certified in canine rehabilitation to the University of Tennessee. Just like in human medicine, rehabilitation can help improve quality of life and return to function after serious injury or illness. At Windcrest Animal Hospital, our skilled team of veterinarians and highly trained veterinary technicians are totally committed to providing state-of-the-art care for your pets. Our passion is caring for pets, and we treat every pet as if it were our own. We are committed to providing proactive wellness care to help your pet live a long and healthy life, as well as providing 24-hour-a-day, 7-day-a-week critical care and emergency services, avian and exotics, cardiology, behavioral consults, and canine rehabilitation referral services. We recognize that you have a choice in your provider for veterinary and boarding and grooming services for your family members, and we are proud to provide care for our clients and their pets. Windcrest Animal Hospital, partners in your pet's health.
And welcome to Save the Animals Adoption Center. I'm Crystal, the director.
And I'm Angie, the adoption coordinator.
Save the Animals Adoption Center is housed at Windcrest Animal Hospital, and that's where we are right now. And we're here today to show you some of our adoptables we have in-house.
So this is Max, and Max has been here for about 6 months. He came to us back in March. Max is about 3.5 years old. He is a Beagle mix. All the animals here have their own story. He came to us because his owners could no longer care for him. So they brought him here, and he's become part of the family, and he's very well trained. He's house trained. He knows basic commands, how to sit and shake, and he's just loving the camera right now. But he's very friendly, and he did come from a house with kids, so he is good with kids, but not, really young kids, but older. And yeah, he's just looking for a good home to go to.
And just give us a call, and we can set you up with an interview.
This is Hamilton. He's one of our other animals up for adoption. He's only been in the adoption center for about a month, and he is about 7 months old now. He actually came to us from one of our veterinarians, Dr. Montgomery. His friend moved into an apartment that didn't allow animals as their policy. So he was brought here, and I don't know if you can hear him, but he's purring up a storm. He's very, very sweet, and he loves to be held and cuddled, and he gives kisses and hugs. Hi, sweetheart. Headbutt, but he's just really looking for a good home, and he's great with kids, pretty much great with everyone.
And he's like, listen to me while I talk to you. Oh, no. Hamilton.
So this is Georgie and Mr. Pibb, and we also have Toby here with us. Georgie and Mr. Pibb, they're about 15 weeks old. They were fostered by one of our technicians that work here at Windcrest, and they were brought to us when they were old enough to be adopted. So they're looking for a home. It would be great if we could adopt them out together, but, that doesn't always work, so go separate. They are both male, and they're up to date on all their vaccines, and super playful, and, just looking for that perfect home. And here we have Toby. Toby is about 3 years old.
3 years old.
Yep, and he's been in and out of the adoption center twice, but he does have some medical issues. So we're looking for someone who can spend some extra time with him. He is great with other cats and other dogs, and he's great with kids. But he's just looking for that good home that can really give him the attention he needs.
So if you're interested in any of the animals you saw today, please give us a call. I'm Crystal, the director, and this is Angie, the coordinator. And you can also see all our animals on www.petfinder.com. And Save the Animals Adoption Center is housed at Windcrest Animal Hospital. So come by and see all the loving animals we have for adoption.